Okay, thank you so much for having me here today. My background is I'm actually a pharmacist by trade and got pulled onto this project as a result of undertaking a health management internship program at the moment through the Australian College of Health Systems Management. So it's been a great opportunity, I think, for both myself and the organisation to get involved in this space. So the Royal Brisbane and Women's Hospital. So we implemented at the Royal Brisbane and Women's Hospital a connected network approach, really for choosing wisely. It's facilitated by a clinical lead, which is me, and a governance team. And we were really lucky to be supported in this governance team space by having someone from our hospital and health service involved. We've got our chair of our Medical Staff Association, our chair of Clinical Council. We have our executive director of the Royal Brisbane and Women's Hospital. We have a clinical lead and our ED, executive director of performance and systems, involved as well too. We're actually currently undergoing a process to actually do an EOI for having a consumer representative on that governance team as well. So as I said, there's an active support of clinician groups and hospital executives. We actually launched the Choosing Wisely program at the Royal Brisbane and Women's Hospital in November 2016. So the Royal Brisbane and Women's Hospital really took the opportunity to challenge all facets of the organisation to think differently about the way healthcare is delivered. We put multiple strategies for engaging stakeholders in place. We had a process to recognise current and future initiatives. We're connecting resources, connecting the initiative to resources. We're a really large organisation and people really are challenged to find where they should actually go for different things like data, research, support, all sorts of things like that. We're actually also co-located with the University of Queensland Medical School, so we've approached them and been liaising with them in terms of whether or not they have any medical students that are keen to get involved in this space as well too. So they've been really keen and really interested in resource stewardship as sort of a part of their program going forward. We've actually embedded Choosing Wisely in our performance framework as well too for the hospital. So this is for the clinical service areas and it's part of their monthly reporting mechanism to the executive director, the executive team at the Royal Brisbane and Women's Hospital, that they actually report on their Choosing Wisely initiatives. So as I said, we took a bit of a different approach. We weren't necessarily focusing specifically on the top fives of the colleges and societies, but we essentially challenged the whole organisation to come up with ways that they could choose wisely. So essentially using the criteria for choosing wisely concepts, we actually have come up with it's an ever-growing list, but currently it's at 134 initiatives across the organisation that are considered to be choosing wisely initiatives. I'll just go through just a quick couple that we've had some great outcomes on. So we've had local anaesthetic initiatives. So we had a situation where in our operating theatres we were using bupivacaine and adrenaline at $30 a vial, and we had ropivacaine at $3 a vial. So it was a bit of a cost thing, but it was also an appropriateness thing. There was a bunch of patients receiving the combined product with adrenaline that didn't actually need the combined product with adrenaline. So we had a huge, we had an education campaign, posters, all those sorts of things. We actually found out that there was a lot of substitution that was possible, and we actually, and it's not, although not clinically appropriate in every patient, we had a huge reduction in the more expensive one, which was the combined drug. We had an intervention in October, November last year, and I'll just show you the growth of the ropivacaine usage. You can see in the red bar on the far side, but you've got the decreasing costs of the bupivacaine adrenaline on this side. We also had a very much a patient-facing project around a fasting clock. So there was concern that we might be fasting our patients a little bit longer than they really required, and we essentially wanted to empower the patients to be able to have the information about when and how they should be fasting. So we had one of our fantastic anaesthetists, Kate McCrossan, develop this patient fasting clock, and it's based on lots of work that's already been done, but we just weren't doing it locally. And we found that for fasting times for food decreased, fasting times for fluids decreased significantly. And patient comfort scores, interestingly, it was significant in hunger, which we didn't have significant results in the Times, but I guess patients' perceptions were that they weren't as hungry because they had the control over what was happening in that sort of space. And thirst reduced as well, but not significantly. So other things that we are doing in this space, well, as I said, we really put the challenge to the organisation to think differently about the way healthcare is delivered. We included a statement in our standardised job description template that talks about the Royal Brisbane and Women's Hospital being a Choosing Wisely organisation and all that comes with that. We've included Choosing Wisely in both our general orientation for all staff and our medical staff orientation at medical junior and senior medical orientation. Oops, sorry. And we have taken a hospital-wide approach to sort of these three areas here: consumer engagement, pathology and wound management. So in particular with the consumer engagement, we're really wanting to do some strong work around inviting consumers to ask questions. We sort of feel as though we need to empower them as well too, but there's an element of actually trying to invite them to ask the questions as well too. So we're investigating mechanisms as to how we can do that in both the inpatient and outpatient setting, and even just had a conversation before about whether or not we could include a statement in all of, that we encourage all of our staff to use to have that open-ended question. Do you have any questions about your healthcare at all levels? Medical, nursing, pharmacy, anyone that the patient comes into contact with across the organisation. So as part of the performance framework, we actually provide a summary of the service areas Choosing Wisely initiatives. We talk about what phase of the project they're in, giving them a summary of concept, whether or not they're in concept planning or implementation phase, and also the status of the projects, whether or not they're on schedule or delayed. We also provide them with a summary of any key achievements or challenges, and this happens on a monthly basis. I guess just next steps from here, we're really wanting to find out how these are being monitored, how they're being evaluated, whether or not there's been any savings in that sort of space. And we're also looking to engage individual departments to determine their top 5 recommendations and how relevant they are in their area and how they're managing to achieve those and looking at reporting those. And we'd like to say that any that are relevant, we're 100%, but I'm sure we're not there yet. That's it. Thank you.